So,
all right, so we've got our attendees on, and Allie is starting to share to the Facebook, and I believe that we should be okay to go and get started.
all right, let's go ahead. Welcome everyone to our first of 4 panels within this project series put on by your Central Ohio Worker Center. This one is going to be on navigating unemployment and pandemic assistance. I'm your moderator, Courtlyn Jones. I'm an assistant professor at the Ohio State Moritz College of Law. I teach and research in issues related to the workplace. Central Ohio Worker Center, it's a 501c3 nonprofit organization with our mission to educate and empower low-wage and immigrant workers in Central Ohio regarding their rights in the workplace and largely their power in our community. COWC, which you'll hear us use the acronym often, promotes a culture of solidarity and one which brings all working people and immigrants together in the fight for economic and social justice for all. So as part of a grant-funded project geared towards educating our community about the rights under the law and sharing the resources that we have, the COWC has composed 4 15-minute short videos, and we're going to be hosting 4 panels that go with them. So like this one, this is going to be our first one, all of which will be recorded and available on our Facebook page and probably on our website too once we get things up and going. This is obviously your first panel. We're going to discuss unemployment assistance, the new federal and local laws related to unemployment compensation, and COVID-19 related assistance. Our second panel will be about wage theft, how workers can recover wage theft or wages that are owed, other legal protections for when you're raising wage issues. Panel 3 will discuss successful strategies and inspirational stories about low-wage workers standing up for themselves and winning improvements for the workplace in other areas besides wages. And then the last panel will be about civil rights, labor history, and knowing your rights. We're going to gear that towards a younger audience, high school students. So please stay tuned for dates that are coming down the pipeline for those. In addition to the panels, again, we have developed some videos. They will be available too. We will play the first one in this panel today, which will talk about unemployment assistance, the new federal and local laws. But before we get to our video in a few minutes, I would like to introduce you all to our wonderful panel who is joining us online today. And they really are fantastic and have a wealth of knowledge. So please send your questions in. We'd love to take them. We're going to start with Hannah Halbert. She's on one of your boxes. I won't even, she's my top right. But Hannah Halbert is the Executive Director of Policy Matters Ohio and a Central Ohio Workers Center board member. She joined Policy Matters as a policy liaison in 2010. Before Policy Matters, Hannah has previously spent 4 years with the Equal Justice Foundation and the Legal Aid Society of Columbus, where she protected homeowners from foreclosures during the housing crisis. Hannah is usually the author of all of the materials that I love to cite for local wage theft and all policy issues, really. We've got Kelsey Ellingsen. She's serving as the legislative aide to Columbus City Council President Pro Tem Elizabeth Brown, right? Since coming to City Council in 2016, much of Ellingsen's work has been devoted to advancing progressive policies that support women and families, as well as immigrant and refugee communities in Columbus. Thank you, Kelsey, for being here. And then finally, we have Zachery McCune. He is the Public Policy and Civic Engagement Manager at Equitas Health. Equitas Health, their mission is to be the gateway to good health for those at risk or affected by HIV, for the LGBTQ plus community, and for those seeking a welcoming healthcare home. Zach is a legislative and public policy advocate who develops and distributes advocacy and outreach materials related to current and proposed laws and leads Equitas Health in its advocacy and communication efforts. So that is who we have on the call. We also have Sarah Ingalls, of course, who might be joining us for a while. She is the president of the Central Ohio Worker Center. And with that, I will take a short break and kick it over to Sarah and hope that she can start our video.
The people of Columbus and our state have been through a lot. The global COVID-19 pandemic has infected thousands and sadly taken the lives of far too many. Some of us have lost our jobs, were laid off, or had our hours cut, or we probably know somebody who did. The virus and economic downturn have taken a toll on our neighborhoods, our families, our friends. This Central Ohio Worker Center video provides you with important information about laws and resources available to help workers and residents in Columbus get through this pandemic and the tough economic times to follow.
Hello, my name is Lisa Oakes. I'm the Chief Executive Officer of the Ohio Association, a professional association and labor organization that speaks for over 180,000 registered nurses in the state of Ohio. Nurses are frontline patient and community advocates. Throughout the pandemic, nurses not only cared for patients and provided comfort to family members, they've also called for workplace protections that benefit all working people.
The state of Ohio has implemented some workplace procedures to protect individuals in the workplace. For example, businesses must follow industry-specific prevention measures, which includes wearing masks, social distancing, or the installation of barriers in the workplace, among other safety measures. The requirements for your industry can be found on the Ohio Department of Health's website. All of us can take action to protect ourselves at work and in our community. Past generations of Americans made great sacrifices for one another. They went to jail for the right to vote. They lost their lives in World War II in a fight against fascism, and they struggled for civil rights and equal protection under the law. COVID-19 has brought considerable disruption to our lives. What's being asked of us at this time in American history is that we wear a mask in public and follow social distancing guidelines. By doing our part, we can help reduce the spread of the virus, save lives, protect one another and our jobs, and help the economy recover.
My name is Rick Lucas. I'm a registered nurse and president of the Ohio State University Nurses Organization. People across Central Ohio and our nation trust and support nurses. We have been on the front lines of the pandemic like so many other workers. As we continue to provide care for you and your family members, you can show your support for us and other working people by wearing a mask, washing your hands, and practicing social distancing. COVID-19 is the most serious health crisis of our lifetime. It's important that we recognize COVID-19 as a serious threat to our workplaces and our communities. Many people who have become infected with COVID-19 report only mild symptoms. But don't let that give you a false sense of security. It's only part of the story. People without symptoms can still spread the virus. As a nurse, I can tell you that some people do become very ill and die from COVID-19. We know that people who have certain serious health conditions are at a greater risk of becoming severely ill or dying from a COVID-19 infection.
Some serious health conditions are treated as disabilities under the law. Individuals whose serious health condition places them in the CDC's high-risk category may be entitled to a reasonable accommodation at work.
The care and community education that Rick and his fellow nurses are providing to patients, families, and communities is something that will be written about in the history books. If you or someone you know gets sick or exposed to the virus, follow the instructions of your medical provider, the Franklin County Health Department, the State of Ohio, and CDC guidelines. These may include isolating yourself if you are infected with the virus and quarantining yourself if you have been in close contact with someone who has contracted the virus. There are laws and benefits available to protect and support you through these tough times.
COVID-19 is not only a public health crisis, it's an economic crisis. There are laws to protect you and economic resources available to assist you during the pandemic.
Hi, my name is Hannah Halbert. I'm the Executive Director of Policy Matters Ohio and a member of the board of the Central Ohio Workers Center. There are laws that provide workers with some protections during the pandemic. One of those laws is the Family and Medical Leave Act, or FMLA. The FMLA may provide some employees with job-protected leaves. Under the FMLA, eligible employees may receive up to 12 weeks of unpaid leave for a serious health condition that prevents them from working. COVID-19 may qualify as a serious health condition if you're incapacitated due to COVID-19 symptoms or complications. This is a fact-based analysis that requires you to speak with your doctor and get medical documentation regarding your serious health condition. Your employer may require your doctor to fill out certain forms or sign off on certain documents, so you should check with your employer regarding the necessary steps to apply for FMLA. You may also be eligible for leave under the FMLA if you're required to care for a close family member, a spouse, son, daughter, or parent who is incapacitated due to COVID-19. As a general rule, the FMLA does not apply to employers with less than 50 employees. Other eligibility requirements apply. There are separate rules for school employees.
For more information about the FMLA and COVID-19, review the United States Department of Labor's COVID-19 and the Family and Medical Leave Act question and answers document. If you believe your rights under the FMLA have been violated, you can file a complaint with the United States Department of Labor free of charge, or file a private lawsuit to enforce your rights. Your employer cannot retaliate against you for exercising your rights under the FMLA.
The pandemic has had a terrible impact on working families, and recent changes to federal law have been absolutely necessary. For instance, under the Families First Coronavirus Relief Act, or FFCRA, a law passed by Congress in late spring of 2020, provided expanded family medical leave for specific COVID-related reasons. This expansion is available to eligible full-time employees of private employers with fewer than 500 employees, and most government employees. Under the expansion, covered employees are entitled to 12 weeks of paid leave if the employee is unable to work or telework because they need to care for a son or daughter whose school or place of care has been closed due to COVID-19. Or because the child care provider is unavailable due to COVID-19. Part-time employees can also take up to 12 weeks of leave, paid as if they worked for the number of hours they are normally scheduled to work over that period. Under the law, the first 2 weeks of leave for full-time and part-time employees can be unpaid, but employees can use accrued paid leave, like vacation or sick pay, through their employer, or new emergency paid sick days, which are also available under the FFCRA. After 2 weeks, employees are generally entitled to 2/3 of their regular pay, but no more than $200 per day. A couple of other points. Under the FFCRA, if a school's physical location is closed for COVID-19 related reasons, it is considered closed for the purpose of paid sick time and paid leave, even if some or all instruction is still being provided remotely. Also, if an employee is enrolled in health insurance through their employer, the employer cannot terminate health insurance benefits when the employee is taking paid leave or sick days under the FFCRA.
The FFCRA also includes up to 80 hours of paid emergency sick days for full-time employees. Part-time employees are included and can take up to the average number of hours they work in a 2-week period. The permissible COVID-19 reasons for taking paid leave include isolation and quarantine orders, caring for a household member who is subject to an isolation or quarantine order, quarantining on the recommendation of a medical provider, experiencing COVID-19 symptoms and seeking a medical diagnosis, or caring for a child whose school has been closed or child care provider is unavailable because of COVID-19 precautions, among other reasons. If you are taking leave to care for someone else, sick leave pay will cover up to 2/3 of your regular rate of pay, up to a maximum of $200 a day. If you take sick leave to care for yourself, sick leave pay is paid at 100% of your regular rate of pay, up to $511 per day. The FFCRA permits some employers, like healthcare providers, to opt out of the law, and small business may also apply for exemptions. The FFCRA is set to expire on December 31, 2020, unless the federal government extends the law. Therefore, if you're watching this video after December 31st, 2020, some of these leave and sick pay provisions may no longer apply to you, depending on whether Congress has extended the FFCRA or passed a new similar law. If you have any questions, reach out to the Central Ohio Worker Center and we can help you decipher the current status of the law.
Hi, I'm Columbus City Council President Pro Tem Elizabeth Brown. There is still a tremendous amount of work needed to help members of our community who are struggling to pay bills and stay safe. We know that an equitable recovery starts with meeting the needs of workers, especially those who have been impacted most. Council unanimously passed a resolution supporting an essential workers Bill of Rights that promotes living wages, health and safety protections, universal paid leave, affordable child care, and proper job classification and quality standards that recognize the dignity of all work. Council established a cap on the fees delivery companies can charge local restaurants. We protected workers by ensuring that those services do not reduce pay or garnish tips from delivery drivers in response to the cap. We want to keep the money that folks are spending locally here in our community to help our businesses survive, to pay workers, and to keep people employed. And I am proud of the Right to Recover program Council launched to offer workers the financial resources they need. About 2 weeks of full income replacement, up to $15 per hour, to take time off, isolate, and recover following a positive COVID-19 test. Giving workers the security they need to get tested and follow safety recommendations during this pandemic protects their health, their family's health, and the health of everyone in our community. Our neighbors, our friends, and our families have been hit hard by this pandemic. But by working together and continuing to put the needs of workers first, we can ensure that everyone in our city can find the safe working conditions they need and be treated with dignity and respect on the job.
It's important to know that if you are unemployed or your hours have been cut due to COVID-19, you may be eligible for state or federal unemployment insurance benefits. Benefits are no substitute for a good-paying job, but unemployment insurance benefits can be a big help when you have lost income because of the virus. If you have lost income because of COVID-19, apply for benefits. You can apply for benefits through the website of the Ohio Department of Job and Family Services at unemploymenthelp.ohio.gov or calling 877-644-6562. If you have questions about filing for unemployment insurance, go to the Ohio Department of Job and Family Services website for information. On the website, you can review frequently asked questions and file for state and federal unemployment benefits. Ohio unemployment insurance benefits are normally available for 26 weeks. Currently, employees may be eligible for additional weeks of benefits due to certain temporary changes in the law. Again, remember that the law in this area keeps changing, so you should double-check its current status online or contact the Central Ohio Workers Center, and we can try to help you get answers to your questions.
In the state of Ohio, eligible workers may be entitled to unemployment insurance benefits if they are required to isolate due to COVID-19 infection or quarantine because of exposure to a person with COVID-19. This is currently the case, but the law may change based on the status of the pandemic and decisions by elected officials. Eligible workers may also receive unemployment benefits if their hours are reduced, their place of employment closes, or they are laid off. You can check eligibility requirements online before you apply and call the Ohio Department of Jobs and Family Services with any questions you may have before you apply. Note that the department holds you accountable for any errors to your application, so you'll want to understand the application fully before signing off on it and submitting it.
Individuals who are not eligible for regular benefits may be eligible for unemployment insurance benefits through the Federal Pandemic Unemployment Assistance, or PUA program. If you're watching this video after December 26, 2020, please double-check the current status of the law. If you need assistance with understanding the current status of the law, you should contact the Ohio Department of Jobs and Family Services.
The Central Ohio Workers Center has made additional materials and resources available on its website at centralohioworkercenter.org. Most importantly, we want to work with you on the workplace and community issues that matter to you. Please join COWC today or register for updates so we can stay in touch.
That's wonderful. Thank you all for joining us again. That video will be available on Facebook and up online. So watch it over again, bookmark it. I know I sure will. And thank you to our participants who helped out with it. For those of you who still have questions, please do. You have several options. You can send it into our Zoom chat. And I do have some administrative help that will try to get those to me and your panelists as fluently as we can. We also have a Facebook chat is going, and I will do my best to get those over into this venue also. That is actually, I wanted to watch the video the first time now. So that's my first time seeing it. And I guess I get to take a little bit of moderator privilege and tell you my thoughts on it, which are that we are recording this a couple days before the new year. I did not wish everyone at the beginning, I hope they had a nice holiday or extended weekend, whatever. I do hope that is true if you're joining us live. And you've had a little bit of time during this short week, right, to just relax and to take a break. I usually do during this time, and I guess I kept thinking about during that video is not this year, right? There's just no time in 2020 to unplug and take a break from workplace law during this nice little short break between the new year and your holidays, because we have had so much go on in just the last 72 hours. So my initial thought on the video is there's a ton of stuff in there that is really great, but also there is a ton of stuff that you will have to make sure that you are checking the website for often and being updated on, in that as soon as we make materials, it feels like we could do an addendum to them. So with that being said, again, we will try to fill in any holes that we have. If we know the information now, we will give it to you. My first thought, and again, this is moderator privilege, I'm just going to kind of throw it out to my panelists, because I am curious how your job has changed in the last year. You're all obviously still working and still healthy, and I'm thrilled to see all of you, but I can imagine it's been very different. And I was hoping that you could help our audience with just perhaps some of the challenges you faced, things you never imagined you would be doing in 2020 that became really central to your role. And I will go ahead and I'm going to throw it to Kelsey first because she's unmuted, and then we'll go Zach, and I'll finish with Hannah if that's okay.
Thanks. Yeah, it has been a wild year. It has certainly. And this is my dog. I'm very excited to hear me talking. But I brought a tennis ball, so it has been just crazy. And not only are we facing a pandemic together, but just a lot of tragedy as a community as we lose Black and brown brothers and sisters to police violence, and we confront again issues that we have failed to resolve. So a heavy year, but I think I'm working alongside a lot of folks who know that public service is their calling, and this is what we signed up for. So at the same time, it's hard, but we know this is our moment to really do what we set out, what we came here to do. But so in high spirits around the holidays, but definitely looking forward to 2021.
Wonderful. Thank you, Kelsey.
Yeah, so thank you, Kelsey. And much like you, I'm distracting my dog with treats so she doesn't bark. So I apologize to any of the panelists and to any of the viewers if you hear any barking. I think very much to a similar degree, I think we're all experiencing a level of collective exhaustion. And we're trying to not only, fulfill our everyday responsibilities, make sure we're checking in on the folks that we can check in on within our networks of support, and within the work that we do. And so making sure that not only are we healthy and well, are we being able to meet our needs, not only our financial needs, but a way to kind of, go past isolation and then to really do the hard, necessary work of reflection as we experience this loss, as we continue, like Kelsey said, to navigate these dual pandemics, not only of COVID-19, but of state-sponsored violence against Black lives and Black bodies. And we do see the disproportionate rate of death and infection happening in Black communities and other communities of color across the United States. And so how do we dig deep? How do we make sure that we continue to push our policymakers forward and re-examine our commitment, not only as a steward of public health in a healthcare organization with Equitas Health, but our commitment to the collective and to one another and to lifting up the work of folks on city council and folks with policy groups like Policy Matters Ohio and coalition like the Central Ohio Worker Center. So it's important that we take this time to reflect and to dig deep, but also take care of ourselves and our loved ones.
Thanks, Zach.
Yeah, this year I think has been about urgency and working hard to try to meet the moment. We've had long-standing needs in our community to change our economy, to build a more just economy, to build a more equitable, inclusive economy, to make sure that those principles of equity and inclusion sort of drive all of our public policy, whether it's criminal justice system, de-incarceration, what we're doing to meet people's very basic needs of food and shelter. And this year has just made it critical and clear that those are things that we have to get right. And so for my job, it's been trying to do my best to live up to that call. And I think throughout our organization, everyone's been trying to work really hard to meet this moment and make sure that what we come out of, like when we emerge from this sort of series of overlapping crises, is something different and something better, and that we're not just going to go back to business as usual or what we accepted as normal before, but really we're coming out of this crisis with a set of policy demands, a way of living in community with one another that really does bring people in. And I think that we can do it. It's all possible. It's not easy, but it's possible. So that's, it's been a tough year, but it can be a transformational year. And I hope that we don't let it slip away from us.
Absolutely. Yes. Thank you to our panelists. That's helpful for me. I want to encourage anyone who is participating at home to please send in your questions. I do have a loose structure, but really what this is designed for. I can get my questions answered later by sending them an email. So really, we would love to answer your questions as well. I think one of the things that has stuck with me this past year is I will admit that I tend to have a bit of a bias towards national law and big problems, think globally, think, what can the federal government do to fix this? And I will admit that the pandemic has renewed my faith or my interest in local government, in basically feeling like they are the direct line to our community and to seeing impact for the better. And I was wondering if, Kelsey, I know we saw a lot of things in this video, if perhaps you could give us a little bit more insight into what kind of resources, for those of us who aren't as familiar with the local laws, but also, I mean, if we could have a discussion on what you think really has the potential to impact our community. I know that delivery services was huge when I saw that coming and thought that was incredibly interesting. And then to hear about as I try to navigate federal law, paid work, and what is going on, I don't always know, but here's the city council who's got something that is done and ready. What can you tell us about that experience and what is available to us in local law?
I almost had to be asked to be unmuted there, and that didn't happen, just for the record. So yeah, again, it's been a really big year. I mean, for us, for our office, for Council President Pro Tem Brown, she's always really been focused on women and families and working families and immigrants. But right now is a moment where they really need our attention more than ever, just because this pandemic has laid bare the economic insecurity that our families are experiencing. So we just urgently have been working to rebuild, improve our social safety net so that they can make it through. We know that every business or child care center that shutters, every job that's lost, every family that's evicted, those are consequences that we're going to have to deal with together for a long time as a community. So I'm excited that we have really come together, not just her, other members of council and the mayor have come together to put together some resources. I think one of the most urgently needed ones is around housing, right? If a family gets evicted, that is just such a difficult position, expensive and traumatic for everyone involved. And so for that, I want to commend Impact Community Action and Columbus Urban League for doing a yeoman's job at getting aid to families. They have been running rental assistance programs, the Hope Fund through Impact, and the Family Housing Stability Program through Urban Leagues. And they have just gotten millions of dollars out the door to families to help prevent absolute disaster. They've also been doing work on utility assistance, and the city has a program also as a provider of water and sewer service and electricity. We have resources available to families. And I guess I don't even want to go into too many specifics except for on one, which is that earlier this year, we started a program called the Financial Navigator Program. And that means that if you've ever heard of 211, you can call 211 and ask someone to speak with a financial navigator. And that person is trained on all of the different resources that are available. I think the issues I mentioned earlier, it's tragic for that to happen to anyone, but it just kind of insults me, the idea that people would not get the help they need just because they don't know that it exists or how to go about it. So we started this pilot program with CARES Act dollars to put butts in seats, have someone pick up the phone and help families who are in that financial distress to triage, to set priorities of like, this is the first thing you have to do, and this is what you're eligible for. And just having that support is so helpful to people who are in crisis. So more than I want to read out a bunch of websites, although I could, I would just say call 211 or go to columbus.gov/financial empowerment and learn about that specific program and the other things that we have in the works to help people through this crisis.
Wonderful. Great. No, that's all really wonderful stuff. I want to commend you for your work. And also, I was hoping we could also talk to Zach again about impact community and these wonderful resources that you have been involved in putting together. I want to commend you for your work there as well, but also hope that you could provide some more information for our listeners on how they can access these resources, find information about what's available to them, and perhaps maybe, just because I'm curious, a little bit behind how you focused in on this is what we need, and how do you get people ready to go and to do this and get funds, available, but also out the door, I think is a really interesting story, and probably a testament to you and your tenacity. So I'm wondering, Zach, could you tell us a little bit more about your work?
Yeah, absolutely. So thank you. Sorry, I was having trouble kind of navigating. There was a little bit of delay on my end. But yeah, so we've gone through a variety of different strategy conversations and challenges as we've been navigating the pandemic. I think early on, we were struggling, one, with how do we continue to keep people in care? Thankfully, prior to the beginning of the pandemic, we had actually started to roll out a teleprep program, which actually was a very effective model for us to introduce telemedicine and telecounseling for our stakeholders. So all across the state of Ohio, we were able to see folks and make sure that we kept them in care. For our patient population, that was incredibly important because we do serve, as was mentioned earlier, those at risk of or those living with HIV. And so having immunocompromised folks who are maybe isolated from their physicians, maybe they were struggling to get their lab work, get their tests, talk to somebody, we were able to make sure we kept them in care. And we have pharmacy delivery services, which really were able to step up and get people the medications that they needed as well. So we were able to work with local partners on that as well. And we did see some encouraging things happen at the state and the federal level, especially early on in the pandemic, to make sure that we extended telemedicine reimbursement rates on parity for at least an extended period of time. What we are seeing and what we are struggling with currently, part of Equitas Health, we have an entity called Bravo, the Buckeye Regional Anti-Violence Organization, that's seeks to mitigate the impacts of violence and really support survivors. We have seen, unfortunately, an increase in domestic assault and violence against the LGBTQ+ community and hate crimes over the course of 2020 and intimate partner violence. So Bravo has been crucial in making sure that they can help survivors, link them to services, and connect with various programs such as rental assistance as well. My dog is echoing, all of our shared concern here. So that's been notable, I would say, as well. In terms of the set requirements, I think it was very helpful early on in the video for some of those industry specific requirements to be noted. And I'm glad that that was incorporated as well. For those who are in workplaces, which they do not feel their safety is being taken into consideration, I do think it's important to note that most employers are covered under the Occupational Safety and Health Administration, so OSHA, and there are specific guidelines. I want to point to two requirements that OSHA has put into place that existed, but the definition has been expanded to take into consideration COVID, and that was most notably PPE standards for jobs that have hazardous conditions, and then also the general duty clause, which requires employers to furnish workplaces that are free from hazards that are likely to cause death or injury. And so there are potential possibilities for workforce if you are working in an industry in which you're not given the accommodations during COVID, and those can be held, confidential. So we have those resources available as well.
Yes, wonderful. And just so we have it on the video, where should our workers, if they want to report any of the things that you just mentioned under OSHA, what do they do if they want to find some information on how to do that and remain confidential?
Yes, you could report through OSHA.gov, which is the website, and that's available in multiple languages. Or you could call the hotline, which is 800-312-6742. You can also report, if you work in retail, there is an online form at the Ohio Department of Health website that allows you to go in and put in an anonymous complaint. You can also call the ODH COVID hotline, which is 833-427-5634.
Thank you. Yes. Yeah. And again, OSHA is one of those agencies where ideally there would be lots of investigations going on repeatedly throughout the year, but more realistically, they investigate what is reported, right? So there is definitely an incentive and a need for workers to let the agencies know what's going on. Thank you for that. That's wonderful. Well, I guess before we completely switch gears, because I'm just so curious, but I have heard of this. I think it was mentioned on the video, and thought maybe our listeners might be interested in essential worker resolutions, any kind of state, local, federal laws that we might be on the lookout for in terms of, a year ago, I don't think I knew of this term essential workers. And now I hear it every day. And we have certainly found that there really are workers we can't live without, right? And how do we know? Well, we've tried to live without everything else. And these are the people who still went to work. What do we do to protect these workers? Do they have any special protections in Columbus? Should they? What should we be looking at in terms of moving into the new year with essential workers? And this is for any of you. I'm sorry, I didn't really tee it up.
I can comment on that. The essential worker resolution that was mentioned in the video and passed in Columbus and other cities in Ohio, Dayton, Lakewood, Toledo, and other cities across the nation is one part of a bigger movement that's desperately needed to happen around correcting, modernizing, reforming our basic employment and labor protections. So our economy it's changed in the last 3 decades. Many of you listening probably know this very well because you're living it. And the growth of the service sector economy, the erosion of the employer-employee relationship through things like independent contracting, gig work, and then some sectors of our economy and some workers were just never included in those labor protections at all, like domestic workers. So it really is past due to look at what kind of standards and protections are available for those folks. And the crisis has demonstrated that those workers falling into those categories, like farm workers, domestic workers, and then those like in janitorial services, grocery services, food service, really are essential. So we gotta do a little bit better. So the resolution, excuse me, that was passed in Columbus and in other cities, basically is a statement that says the city of Columbus or the city of Lakewood, the city of Dayton, the city of Toledo, they are going to support and work toward having state and federal laws that really do provide some basic protections and coverage to these categories of workers. That includes things like health, safety, whistleblower protections, true medical and family leave policies. You heard on the tape that some provisions were extended through the second round of COVID relief legislation, and we can have a conversation about what's made it through into next year. But to really get true medical and family leave for workers, to improve our labor practices so it matches how labor works in today's reality, healthcare security, affordable childcare, and also to bring real accountability to companies who want to shirk the law. And that protects those companies out there who do follow the law. So this kind of package, what we're really trying to advocate for is really a win-win. It's a win for working people, a win for those companies and employers who want to do right by their people, who want to invest in their people, and they don't want to have to compete with those who want to bend the rules for their own benefit. Now, this is important because it is a resolution. It's a resolution that says that the City of Columbus supports these kinds of programs. They want to see these kinds of laws move from resolution into action at the state and federal level. So there's a growing campaign, both here in Ohio and across the country, to take that resolution into action. And so folks can look to the Central Ohio Workers Center. If you're on Twitter, Essential OH for the Essential Worker campaign here in Ohio, or look at Policy Matters Ohio for some updates on what's going on with essential workers resolutions or essential workers Bill of Rights at the national level. So it's really exciting. It's a step in the right direction. It's an acknowledgement that conditions have changed and we need our laws to catch up.
Yes, yes. And laws are trying to catch up, right? Speaking of laws that are trying, we're going to switch gears now and talk a little bit about what is going on at the federal level. I may rely on Hannah a little bit and put her on the spot, actually, because this is 72 hours old, and I didn't tell her I would do this, but so we've been talking in the video, and obviously we are discussing this on December 29th. There's been a lot of trepidation, wondering about whether or not the Families First Coronavirus Relief Act would be extended into the new year. It has, to some extent, right? There are some differences, and I'm wondering if I can put Hannah on the spot and say, Hannah, I know you've read the new extension of the law. What are some of the major takeaways that you think workers should know in terms of unemployment assistance, also workplace leave, that you take out of this new extension moving forward into the next year?
Yeah, I think we were optimistic when we were putting the video together that a lot of those provisions would be extended. Just it would make sense to do that, seeing as how we're still very much in the middle of the pandemic. But some of them didn't make it through. So I can try to provide a very top line update for folks. Right. A lot of the guidance on the new laws is not even remotely out yet. So watch this space as that comes out. But the paid sick and partial paid emergency family leave that we discussed in the video will expire on December 31st. That mandate that employers between 50 and 500 have to provide that mandate expires. However, the bill does include a refundable tax credit for employers who continue to provide the paid sick to cover their costs, okay? So the federal government is basically saying, we're going to foot the bill on this, but it is in the employer's discretion on whether they continue to provide that leave, right? So it is a check with your employer. If they say no, maybe mention that the costs are covered. The Worker Center can be a resource to talk through some of the, what can you do? Are there things that what avenues are available for you if you are in that situation? But unfortunately, that mandate that requires your employer to allow you to have that critical time off did not get passed through. Now, that alone, that mandate was likely impacting about 87 million workers. And studies showed that it was actually effective in helping slow the spread of the virus. So it's really it's a big loss for working people that mandate was allowed to lapse. Now, the news you probably hear a lot about is the stimulus check. Are we going to get $1,200, $2,000, or $600? And what has been signed in the law so far is $600. So that's a big gap between what people need and what is currently on the table to be provided. Now, there is one positive change in that, though, is that the new law will allow citizens who are married to people without Social Security numbers or who would be considered undocumented folks to receive that support. So the previous stimulus did not. This one allows that. So that is a step in the right direction. Now, will this be increased to 2,000? That is still an open question. Legislation to do just that has passed the House of Representatives. It is awaiting action in the Senate. So if Mitch McConnell decides to take that up, we may see that happen, but that's where that sits as of 12:54 today. And then one other piece of good news, Kelsey had mentioned the critical need for housing. The CDC's eviction moratorium was extended, but just through January 31st.
Yeah.
But the bill does authorize additional assistance or additional funding for rental assistance of about $25 billion in rental assistance. Now, how that's going to be distributed, are there changes to that? That's going to take a minute to sort out and make sure, and once the guidance shows up, but that's good news. The unemployment programs are being continued. Now, there's a question of whether the pandemic unemployment compensation, which was the additional $600 that people could get through the federal government on top of their unemployment, that was reduced to $300 in a temporary wage protection program when it expired. That is sort of showing in the new provisions. So $300 of supplemental unemployment benefits through the pandemic unemployment compensation programs for about 11 weeks. Some workers who have mixed incomes, so they have some money from gig work and some from more standard employment, there's the potential for an additional $100 in unemployment for those workers. But it's not clear until we get the guidance on how this is all going to shake out. Now, one thing people should know is that because this bill was signed a day late and those programs were allowed to lapse, there is a question of whether folks will be losing 1 week of unemployment benefits. So there are lawyers and policy wonks working very hard to figure out if there's a way to get that week into coverage. But that's another piece of sort of watch the space to see what happens. But for now, those big programs like the pandemic unemployment assistance that covers those that are not covered by state unemployment, those things have survived. It's working out the details.
Yes. And we did have a question that came through on Facebook that was asking whether or not any of these new additional programs would be retroactive. And my guess is, I'm thinking that person, I'm guessing, I don't know, is probably asking about the unemployment, right? And whether or not these pandemic unemployment assistance relief will be retroactive if you've already exhausted your weeks. Answer?
So there is a question of whether it's retroactive. That's, people are trying to sort that out right now. So I'm sorry, I don't have a definite answer to that.
I wanted to throw it out there because it is something we are talking about. Watch the space. I don't have a great answer for that right now.
They did do an extension of federal emergency benefit extension. So the total number of weeks will be kicked out. So that did make it through. So your specific case, right? Like, how many weeks have you been on? Have you used weeks before? Check out with the Worker Center. Local legal aids have been providing really critical services on those kinds of questions. So if you're kind of stuck and confused, reach out. We can try to help get folks through that.
Yes. Thank you. Yeah, that's still very much in the air, but if you had exhausted your weeks, we have now extended and provided for additional weeks in terms of if that would be retroactive and that you hadn't, you filed before the new weeks were available to you. Yes, you are going to be eligible for this additional extension of weeks. Thank you so much for that, Hannah. Yeah, there's a lot going on. I mean, the dollar for dollar incentive program to encourage employers to still pay for time off. I don't know how that is going to shake out. We did lose the mandate, and I think that is a great loss. Obviously, with the loss of the mandate, we have also lost the requirements under the law that would have protected you or would have said that you had to be placed back in the same job that you had before you took the time off. I also think, and again, Hannah will help me if I'm not correct about this, but if you've already used your time, right, under the Families First Coronavirus Relief Act, you don't get new time, right? 2021 does not allot for you any additional time in the new relief. Is that correct, Hannah? Is that right?
Yeah, so if you, the time that would have been provided through the FFCRA, so if you're doing the paid sick, so your employer doesn't offer that, you're relying on the federal paid sick, emergency paid sick program, all of that stuff expires on the 31st.
Right, wonderful.
So
yes.
It is really disappointing, and that's going to be a hardship on so many people.
So many.
But we know we could do it now, right? Like we know we could have policy and programs to fill that gap in people's lives, to fill that gap for working people. So the question is, how do we get from here to there and making sure our policymakers are doing what they need to be doing to get those programs in place?
Absolutely. Yes. And I've got another question. This might be the last one we've got time to take. It is another local one. I'm telling you, local city law. So I might ask it to Kelsey. For folks here in Columbus, do you know if the additional rental assistance in the new COVID bill will be distributed through Impact and Urban League, or will there be a new local program for rental assistance that people will need to apply for?
Sure. Yeah. And Hannah, I don't envy you having to do an analysis on the largest bill in history in just a few hours. So I am even less of an expert, but I can say that this time around, we didn't succeed in getting additional aid directly to state and local governments. However, there was that $25 billion for rental assistance that was set aside there, which I understand will be distributed in the same sort of formula as last time. So I don't know exactly what that means, but I know that I think Columbus might have been the only city in Ohio to receive the $157 million is what we got originally from the federal government. So we can hope that those funds are going to come our way. But yeah, again, Impact Community Action and Columbus Urban League, their efforts were funded quite a lot by the CARES Act. And so I think this whole year with the CARES Act funding was a year to pilot new programs and to see what works. So I am hopeful that we can take the new funding set aside for rental assistance and any grants that are available for small businesses and apply them to what's been working over the last year. But I would be remiss not to mention that our own city budget has been, I can't say made whole, but just lifted up so much by the funds that were made available to us. And because of that, we're in a better financial position for 2021 and are right in the middle of adopting, crafting an operating budget for 2021. So just want to do a plug right now to say that anyone that wants to engage on that and lift up what they think are the most pressing needs for either their small business or their family or what they think Columbus needs, they should really lean into that process. So we're regularly posting updates on the council members' Facebook page. So that's Live For Us, for is a word, or you can go to the City Council Facebook page, which is COLS Council. And we really do want people's input so that we can craft a budget that responds to their needs. We know that the coronavirus has been one giant economic shock for all of us, but we can build solutions that respond not just to this crisis, but to the ones we know our families are going to keep facing.
Wonderful. No, thank you for that, Kelsey. And should they also watch the same resources, the council Facebook page and stuff, for any updates on rental assistance and any changes to how to do that. Will they also come through there, or should they watch somewhere else as we're working through that?
Yeah, so I think on that piece, I would continue to direct people to 211. I think they're pretty read in on what's funded and what's not. I know that the two programs we keep talking about for rental assistance, I believe they have a wait list right now. They're not entirely CARES Act funded, so I know if they're trying to make their other funding streams pick up the slack, that's what they're doing. But certainly as we get closer to adopting a budget, if we have budget amendments, those are going to get pushed out, and there will be specifics about what money is going toward. Last thing, I left quite a lot of information out about Right to Recover because the council member, she spoke to it in the video, and I think it's pretty well understood. But that is one initiative that our office sponsored that we did actually fund before the year was out using non-CARES Act dollars. So in addition to ensuring there was no gap in that resource, which can fund anything, it's for folks who, if you get coronavirus and you have the impossible choice between protecting your financial health and your actual health, we want to take them on that position. So that's still available for folks to apply to whatever expenses they have, whether it be it rental assistance or food or otherwise. So they can just contact Urban League for that still to this day.
All right. Thank you so much. Yes, contact Urban League for the Right to Recover funds. I am out of time, but I could go on. I want to thank our panelists for all of their input and plug our next program, which will be tomorrow at noon. We're going to discuss wage theft. It also has a video and another esteemed group of experts. So please do check in with us tomorrow. Also, please check in often. There will be, the next couple weeks will be busy weeks as we try to work out how this new law is going to fit in with our local stuff and try to figure out how it all works. So again, we really do want to be a resource for you. But I do say one of the things that is new about this year for me is not always knowing the law. And I used to feel pretty confident as a teacher that I knew workplace law. So we are figuring it out and navigating it at the same time. But thank you all for your time. I want to encourage you to please do check out the resources that have been placed in our chat. Check out any of the resources available on the Workers Center. And again,